WION spoke with Bruce Harrison from the South Korean capital of Seoul. Let's listen in to how clubs in Seoul are turning into COVID-19 clusters.
I think this is a very good example of how difficult it is going to be to return life to something normal, or perhaps what it was before the COVID-19 outbreak, and it may be a sign that it's just too soon yet to ease those social distancing measures, because it was only days after the government more or less gave their public the blessing to socialize and to get back out there that we had this outbreak at these nightclubs. It's concerning. It doesn't necessarily mean the government's not prepared to tackle it. South Korea has by no means said they're declaring victory on COVID-19. They've actually anticipated there would be cluster infections popping up. This one is starting to grow, though, in number that may be concerning to many people here. 86 cases, I believe, now connected to those who tested positive from visiting the nightclubs. This includes their family members and friends as well. So the government's racing right now to track people who may have been in contact with the infected patients and try and put out this fire, so to speak, regarding this latest cluster infection. No, not at this time. Because of the spike in cases from the positive patients tested to these, linked to these nightclubs, Seoul, as well as other cities, have issued shutdown orders for certain nightlife and entertainment venues. But this does not apply to most businesses in the country here. And they're still encouraging small businesses and others that cater to different customers, whether it's a bar or restaurant, to not close their activity, but to take certain guidelines, safety measures, to make sure that the customers and the staff are in fact safe. South Korea is not flirting with a lockdown of any kind because of this outbreak. And like I said, the government had anticipated cluster infections, and they were prepared with their testing program, contact tracing, and isolating, quarantining patients to address these flare-ups. This one is rather large, but by no means the government feels they can't handle this outbreak. You mentioned, interestingly, a lot of these countries are starting to ease certain measures, though there are still cases. We really didn't see that significant easing here, social distancing guidelines, until Korea hit 0 cases. So they were quite cautious. But there's only so much time you can take before you really damage the economy, especially for those small businesses, before you reopen and try and create some kind of balance between safety and life as we knew it.